Hello everybody. Today we are talking a little bit about shoulder problems and knee problems. We are going to start with shoulder problems. She's Kathy, my name is Lennox. So Kathy, you told me you have a pain in your shoulder?
Yes, in the front here.
From here, okay. So we are going to teach Kathy that she has first stretch these muscles, that is the pectoralis muscles. So in your home, or we can do it as well when she comes for the treatment. And in this case, these muscles, we need strengthening exercises, to can go to this position and decompress the tissue that is here, Okay, so Kathy, so when you are at home, you are trying to first warm this area of your body. So how you're gonna warm? You don't have to use oil, you can use just your hands. You are gonna start to stretching, to do like the fascia treatment. The fascia is like the pillowcase for your muscle. So you are gonna take this one and gonna work in this position, many up, down, all the direction that you can do it, okay? When you want the area, you are gonna do stretching the pecs muscles. So you are gonna take, for example, go to the wall or go to the door. I'm gonna put the position, in this position, the shoulder to stretch the pecs, So we can do here in this position, we can do here, and we can do here in this position, okay? So you are gonna try to keep in this position 30, 60 seconds, okay? And repeat 3 times in each shoulder, okay? And if you can do it 3 times during the day, it's gonna be much better, okay? Just try to do it. If you can hold 30 or 60 seconds because you feel the pain, so you start 50 seconds and then through the day you are gonna increase it. The idea is that you feel, sometimes we confuse with muscle tension and pain, So the idea is that you feel that something is pulling, that is the tension and not the pain. So when you do
I
the
just
exercise,
feel the stretching.
Just
in my biceps.
Okay.
And my shoulder and the chest.
Okay, and the chest, okay? Usually try to keep, very straight the position. If you can do the exercise in front of the mirror and you can see your posture, is gonna be much better, okay? When you count, you have to count 1, 2, no, 1, 2, 3, 4, 5. Very good and slow, okay? And the same exercise for the shoulder, okay?
Yes.
You can do as well another exercise that you can do is stretching here. You do this position here, so we can do a little bit up and we can do a little bit here, okay? If you go here, you can do as well at the same time in this position. So you are gonna do it. How do you feel? You feel the stretching?
Yes.
Any kind of pain?
No.
No? Okay, perfect. So remember that for the shoulder, come here, Kathy. Shoulder have a lot of range of motions, This movement, the flexion, the abduction here, the extension, the external rotation, and the internal rotation. So when we have any kind of problem shoulder, of the range of motion decrease, okay? So another exercise that you can do, and when you are, for example, in too much pain, and you can do by yourself this movement because you feel the pain. So you can go in front of the wall like that, for example, in this case, and you are gonna start like walking with your fingers up. So you can do it slow, slow, slow. So this is gonna help you to increase the range of motion, and it's not gonna be too much painful for you. Or you can use, for example, a small balloon, and you can use as well with the balloon or the ball, go very slow. Now we are going to talk about something about the knee. We are going to start with this moving here, the fascia of the muscles. That is going to help you to warm the area and to pull in, the skin from the bone and from the muscles, Any pain? No?
Yes, I have a pain.
Yeah. So after doing this, we are gonna teach her, she can do as well the same movement of the fascia here in the gastros, in these bones as well, because the insertion of these muscles are here, so it's muscle that is part of the knee. So the same, you are gonna move by yourself, you are gonna do this one, okay? After that, you are gonna always, in this position, you always have to use one pillow here because it's gonna help you first to reduce, the muscle tension on the knee and to reduce the muscle tension as well at the lower back. So we are gonna protect here 2 joints, okay? So in this position, what you are gonna do? That's gonna help you to reduce the swelling, to reduce pain. It's like you are gonna try to squish my hand or the pillow, no, going down, like that. That is isometric contraction. You are gonna hold here between 6 to 10 seconds, very slow, and relax. And you are gonna repeat again and relax. Try to do this one 4 or 5 times, okay? It's gonna help you to reduce, as I told you, reduce swollen pain and to use as ways to warm the area, okay? After this exercise, you can bend the knees, both one. It's another exercise, simple, that is gonna help you. You are gonna use one pillow, one like a towel or one ball, and you are gonna squish it like that. And you're gonna hold the same 5 to 6 seconds, a little bit shaking. Sometimes when it's shaking, it's because it's weakness or because tiredness, and relax. It's gonna help you as well. Again, and relax. Very good. Okay. So after this is a lot of kind of exercise that you can do, but now for simple words, after this exercise, it's gonna help you to warm this area. So we can work as well in the stretching, when the area is warm. So for the stretching here, these muscles, the hamstring muscles, so we are gonna use, you are gonna bend this knee to protect your back, your lower back. And we're gonna use, you can use one blanket or whatever you can do here. You are gonna up, place here, and get here. And it's gonna stretch, you feel the muscle tension here?
Yes.
Okay.
And also my calves.
On the calves like that, okay. So you are gonna hold the same here, 30, 60 seconds. It depends, And repeat always the exercise in both legs, okay? 3 times during the day as well. Remember, first warm the area and do the stretching, okay? And relax, okay? Okay, this one is gonna help you with the hip, with these muscles, hamstring, and with the gastros, okay?
Okay.
Okay, another muscle that is really important is a lot of muscles, but it's huge muscle gonna help you to stretch. So for this exercise, we are gonna sit, Kathy, and we are gonna stand up. So for this muscle that we are gonna stretch, you are gonna hold yourself. So just gonna up this leg, like that, and same, you are gonna stretch and hold like 36 seconds as well. And like she say, now that she say that it's painful some posture, we have to see with the patient and tell that if any kind of posture or exercise worse the pain or cause pain, don't do it, because maybe during all your life this is the anatomical position that you have, and around this time we can change it, So we have to be careful with that. Any kind of posture exercise, try to correct a little bit, but it causes too much pain, just don't do it. So for both legs, the same, okay? So how do you feel?
I feel good.
Feel the stretching?
Yes.
Okay,
I
perfect.
use gym every day almost. That's why
This is very good.